Hello everyone, my name is Heather Tick, and I'm here to introduce you to the Integrative Pain Care video series. This series is being created in 2023 during the Year of Integrative Pain Care for IASP. So to start off with, let's find out what is integrative pain care. Integrative pain care is evidence-based and comprehensive care. It should follow the evidence and include all evidence-based disciplines that are appropriate for the care of the patient. There needs to be evidence of effectiveness. There needs to also be respect for the integrity of the normal physiologic processes in order to minimize the side effects, the adverse effects of drugs and procedures. We also need to respect patients' preferences and cultural considerations. Now, very often in medicine, we strive to get a diagnosis, and then we use medications very often to alleviate symptoms that go along with that diagnosis. In integrative medicine, we have more conversations about how do we achieve better health for the patient, regardless of what diagnosis and symptoms that they're having. Because often, if we can help them be healthier, their symptoms themselves will be improved. Many of you might be surprised to learn that genetics accounts for only 20 to 30% of our health outcomes. Lifestyle accounts for up to 70 to 80% of our health outcomes. We are not destined to get every disease that is coded for within the genes that we inherited from our parents. There's a process called epigenetics that is the modification of gene activity and gene expression. In essence, it is the turning on and off of genes. And the trigger for this is mostly environmental factors. It is the things that we do, our habits, whether they're healthy or unhealthy. And therefore, we have a tremendous amount of control over our health outcomes. There's no changes in the DNA code when these epigenetic changes happen, and they can be inherited. That has been shown in humans as well as in animals. This study called EPIC is an excellent example of demonstrating this. They followed 23,000 people for 7.8 years. And they were looking for, in these samples of 23,000 people, of people who didn't smoke. They exercised 3.5 hours a week, such as a half-hour leisurely walk. It didn't have to be anything heroic. A healthy diet with vegetables, fruit, beans, whole grains, nuts, seeds, and low in meat consumption. So this would be something like the Mediterranean diet. And having a BMI under 30. And what they found was, for people who had those four behaviors, when they compared them to 46,000 people that they also followed for 7.8 years, this is the amount of disease that was prevented. 93% of diabetes, 81% of heart attacks, 50% of strokes, and 36% of cancers. And so that shows you how dramatic these behavioral environmental issues can be in preventing disease, as well as reduced suffering and reduced pain, because pain can be associated with any of those four conditions that we listed. Another way of looking at integrative medicine is to look at root causes. And so we focus on what underlies, what precedes the development of disease, and can we then be doing more for prevention? The autonomic nervous system, which is our stress-de-stress system, can have a major impact on the development of ill health and pain. Our nutritional status, our general lifestyle choices. Do we have a good social environment? Are we constantly seeking out things that stress us, or do we also look for things that please us? Do we spend time in nature, for example? That's been shown to have an impact on health and well-being. Toxic exposures, this becomes more and more an issue as the earth becomes more and more exposed to toxics, and there are tens of thousands of chemicals in our environment, many of which have never been tested for their safety in people. Our mitochondria, those are the little energy factories in our cells, and we have to keep them healthy, and they're sometimes can be pretty delicate. And then the microbiome, there'll be a lecture on nutrition and the microbiome as well, so I'll be able to talk more about that. Integrative medicine is not all that different from conventional medicine. We may have some slightly different priorities of how we spend our time with patients. We may talk more about what you eat, drink, think, feel, and do, because we see that as a powerful way to induce healing and improve health, even when there are chronic diseases present and chronic pain. I hope you will spend some more time exploring some of the videos that are going to be in this series. They are by top experts in research and clinicians who are sharing their knowledge with you on different topics, different strategies for treatment, different aspects of their research, and just interesting things about what goes on in the pain world. For more information, you can look at these 3 references that I have here. The first article is available for free online.